We're learning more tonight about a new and rare disease found in children. Doctors believe it could be connected to COVID-19. It's called Multi-System Inflammatory Syndrome. Fox 47's Christiana Ford talked to a doctor who says early detection is crucial.
When this pandemic originally started, the concern for children was that they could potentially infect parents and grandparents. Now, as they face their own threat, doctors want parents to be aware.
But now I think the game has changed.
A new demographic at risk: children. As doctors learn more about the novel coronavirus, a rare condition called Multi-System Inflammatory Syndrome has emerged.
It appears to be an autoimmune phenomena that is occurring following a COVID infection.
Dr. Rudolph Valentini, Chief Medical Officer of Children's Hospital and DMC in Detroit, says they've seen 20 to 25 cases in children from 3 months all the way to 18 years since April.
Is that alarming to you?
Yes, it is.
Dr. Valentini says the symptoms mimic another condition, Kawasaki disease. Fever, rash, strawberry red tongue, sometimes even abdominal pain or diarrhea.
Kawasaki is the name of a vasculitis. It's an inflammation of the blood vessel that we typically see in young children. We don't really know the underlying cause, but it is something that can cause irritation to the blood vessels of the heart.
This new condition putting 10 to 15 of their cases in the ICU, with some requiring ventilators.
What's really, really scary is that they're developing a lot of heart involvement, which ultimately requires ICU care. Sometimes to be put on blood pressure medicines to keep the blood pressure elevated, to help the heart pump.
Experts at their hospital started connecting the dots and associating the symptoms with COVID-19 after seeing reports from the UK and New York. And Dr. Valentini doesn't believe the issue is isolated to just the southeastern part of the state.
You know, Detroit's heavily populated. We've been heavily impacted by COVID, so it's probably not a surprise that we're seeing it here, if we're going to see it in our state. But I don't think Detroit's got, exclusivity on this. I think
it is treatable, but he says parents have to act fast.
If their child has fever for a couple of days, they're not acting right, they're moaning and groaning, saying their belly hurts, maybe they're having some diarrhea, pick up the phone and call the pediatrician.
Reporting in Lansing, Christiana Ford, Fox 47.
Dr. Valentini says he sent a memo to pediatricians across the state. He says because of that and media attention, 2 patients have been admitted to the intensive care unit.